She did not want to be touched.
That is correct.
That's a symptom of RSD.
It could be.
All right.
Could be a behavioral manifestation.
Okay. And she had a fast heart rate, right, which supports being in pain, does it not?
It could.
Knees are flexed up into the abdomen. That can be an indication, right?
That's a positional description. I don't know what that has. I don't know if that has anything to do with CRPS criteria. It certainly isn't Budapest criteria, to my knowledge, that positioning yourself with knees up to the chest is confirmatory objective evidence of CRPS. I'm there to evaluate whether there is evidence to support a diagnosis of medical child abuse. I'm not there to complete my evaluation unless I have to by saying, I don't know, this is all the information. It could be either, you decide. My task as the child abuse pediatrician is to evaluate all of the medical records, look for every piece of objective evidence that I can, evaluate all of the information in context, look at objective observations both in the presence and in the absence of the alleged perpetrator, and try to put all that information together to assess whether or not there's sufficient evidence to support a diagnosis of medical child abuse. There was I believe there was a day or so that there was some videotaping of the child in her hospital room in an attempt to document the amount of movement that she was and the activities that she was undergoing in her room when people weren't present or when doctors weren't present.
Who directed the video surveillance?
I guess I don't know, they have a setup at the hospital.
Who directed the video surveillance?
I had discussion with the hospitalists. I don't remember exactly which one it was at that point in time about the possible benefit of that activity.
What did you find with the video surveillance?
There were numerous instances during the video which were comparable to numerous observations of the physical therapists, the nurses, the child life staff, the music therapy staff, etc., of the child moving around in bed, putting her feet in normal neutral position, using her upper body, her lower body in various movements that provided concrete evidence in support of all of the observations that were made by numerous hospital staff.
How does any of this indicate child abuse?
How does any of what?
The concrete evidence of her video of Maye Kowalski in her hospital room.
That was related to, she's 10. So as the children get older, there can be a component of the child having been sort of participating in the medical child abuse. One of the ways that this occurred in this case was that the child had very inconsistent patterns of movement and reports of pain in response to certain movements and numerous other observations that were made by the hospital personnel. So this was an instance in which there was specific objective documentation that could be presented, if necessary, regarding what was being described and reported by numerous treating providers at the hospital.
How much involvement did you have in Maya's care from the time of her admission throughout her sheltering at Jon Hopkins?
So as of October 13th, you mean? I talked to several physicians. I think we've talked about that already. I reviewed information as I was preparing my report.
And beyond October 13th, up until the time of your report, how much involvement did you have in her care?
I was not a
Check
treating
the form.
physician.
That's not my question. How much involvement did you have in her care?
I had conversations with
Check the
some
form.
doctors.
Did you direct any actions?
I had discussion with several doctors at various points in time regarding things that could be considered to improve Maya's safety and her and the effort to have her have a more effective separation from her mother. There were a lot of times when she was Skyping with her mother, even though she was sheltered in the hospital. And so there were some discussions related to ways to minimize effects on her safety related to that.
Beyond discussions, did you direct any actions?
I don't believe so specifically, no.